Hey beauties, and welcome back to Aesthetic Chat with Kiki. I'm your host, Kiana Gamble, and this is another episode of season 6. Excited to have our next guest on. You may recognize her from Instagram. Her name is Shelbi Sloan. Excited to have her on the podcast today as she has transitioned to a lot more virtual and like wellness compared to aesthetics, is my understanding. So excited to learn more about peptides and her approach to wellness and building out that side of your practice. So enjoy this episode, beauties. All right, everyone, welcome back to the podcast. We're excited to have Shelbi on today. She's going to talk all about peptides, wellness, and an entire sector of aesthetics and wellness that we haven't actually covered on the podcast, which is really exciting.
Thank you for having me.
Absolutely. So, first, kind of give everyone a brief background of who you are and kind of how you got to where you are today.
Okay, I'll do a very short summary because I have a little bit of history in the aesthetics and wellness realm now for 5 years. I basically lost my NP job working before COVID. I lost it kind of during COVID. And I went back to the bedside as an RN and worked 7 ICU assignments and opened my first med spa in Scottsdale. I moved from Arkansas and opened it. I was in a little suite and then started growing my business there. And then I was kind of crazy and was like, well, let me open up another one back home because it's easier. And so I opened up my second location about a year and a half after Scottsdale, and I started traveling back and forth. I did that for 2 years, which is kind of in this fight or flight. I had a team in both, kind of like operating and running. At one point, I had a team up to 9 people. With no office manager. So it was a lot. So I've kind of transitioned the business in 2025 more to my vision. And, the aesthetics and wellness realm is growing. Aesthetics is growing, wellness is growing. And I previously worked in cardiology as a nurse practitioner for 2 years as a baby NP. So when I went into COVID, I already had a lot of really amazing experience. And then went into COVID and got even more ICU, it's like critical thinking experience. And I think that is what helps me with my wellness realm today is just having all of that nurse practitioner, nursing, critical care experience. So this year in 2025, I closed my Scottsdale location, brick and mortar, and I went all virtual and moved back home to Arkansas. And I'm happy to be in one overhead now and running kind of this virtual wellness program. I was really kind of struggling with what I wanted for me long term. And I knew working in 2 locations was not sustainable for someone that wants to get married and have kids. So I also was trying to balance personal life and business life, which is very hard. But that's kind of how I opened my businesses, like moving from Arkansas to Arizona and then now back home. It's really nice being back home and having that one overhead. And I feel like people back home are really loving that I'm back and that I'm wellness focused. So it's definitely good to be back home.
Nice. So, are you injecting at all still, or would you say, talk about that split now? So, how
Yeah.
much time are you devoting to maybe the wellness side versus the aesthetic side versus like
Mhm.
being a business owner?
Yeah, before I moved and was balancing both, I was flying back and forth to Arkansas about every month or every other month and kind of maintaining and keeping up with the business virtually. Scottsdale, obviously, I was working more than 1 day or 2 days a week. Now in Arkansas, I'm injecting about 2 days a week. And in those days when I'm injecting, it's also running some virtuals through that.
Okay,
And then,
gotcha.
so I might have like 2 injecting days and then one just virtual day, or I kind of mix it up in between my office days. Some days on Monday, so Monday is always admin day, where you go through everything. I like to start my week that way. I prep for my meetings Sunday night. If I'm having a lot of meetings on Monday morning, Monday is like admin day where we kind of do all of our social media. We're putting everything out for the week. And usually I'll inject Tuesday, Wednesday, or see virtuals, and then my nurse will work Thursday, Friday. when she's not also not assisting me, right? So she kind of helps me with the wellness now. So my injector,
Okay.
I just promoted her to full time. So she's kind of diving into the wellness too, just because we needed help and she's my employee there. So I have an esthetician and a nurse right now in Arkansas. And so it keeps the overhead nice because I can still see virtuals in Arizona, but there's really no overhead there. Having two overheads as a business owner with the recession in the economy and the election, aesthetics is down about 20%. So that's why you're seeing more med spas do wellness. But you want to make sure you're, of course, learning and using the right resources and giving patients like the best care, right? That 5-star wellness service
Right.
care.
Right. So, question for you. You mentioned that at one point you had 9 staff members underneath
Yeah,
you. Was that at one location? Currently, you said you have an esthetician and you have a
a
nurse,
nurse. Yeah.
but
And
how many
then
people are in the location?
yeah, just 2 right now, and
Oh,
then
okay.
I have a virtual assistant, basically, that kind of helps me with a lot of my admin tasks, and I think if I didn't have a VA, it would for sure be a lot. You would get a lot of emails that come in, especially when you're medical directing too. I medical direct for 2 girls in Arizona, so if they're getting samples and things like that, there's a lot of stuff that's coming into the email that we have to filter and cycle through. So I'm kind of on call for my wellness program and the girls in Arizona, although they're very competent in what they're doing, so they don't need me as much, and I still fly there to do some pop-ups and check in on them. So I'm still kind of doing my medical director duties in Scottsdale and kind of on call. But like I said, it's not too bad. I'm not medical directing in Arkansas. I'm not trying to create a lot more work for myself. I really like my virtual balance. Seeing my wellness and weight loss is amazing. Like, I love it. I love helping patients feel better, not just from the filler and the injections, which is also an amazing feeling, to help give someone a new face, right? We know that. It's one of our favorite things. It's what keeps us going. But what I love so much about the wellness is that it gives me joy again in aesthetics. So I'm not just producing for revenue in that day, like, yes, we're working, we're injecting, we're ethically injecting, but we also have to meet sales quota, right, for our overhead. So, how do you find that balance of being an ethical injector? You have big pharma down your throat pressuring you to purchase, and you're leaning on your wellness program to also grow naturally. And I think, if anything, the wellness is slightly busier than the aesthetics right now, is what I'm seeing in summer. Everyone wants to look good, yes, but they also want to feel good, is what we're noticing. The switch.
Nice.
Hmm.
Gotcha. So, with wellness, have you gone and done like functional trainings? Find how you're approaching wellness.
Yeah. So I'm kind of approaching wellness when I do a consult. It's 199 for 30 minutes of my time. And I really customize it for every patient. So I'll kind of talk to them. When was your last labs? Like, take their full medical history, see what their goals are. They might have some short-term goals that they want to reach, and then I'll put their long-term goals in the soap note. I'm assessing their sleep. How do they feel like their stress is? I'm recommending most of the patients that are high stress, high performers, a lot of entrepreneurs, to wear an Aura ring. That way they can track their sleep. We know that with peptide therapy, decreasing that inflammation in the body helps decrease like that cancer causing diseases, those chronic diseases. And so really a lot of what I'm doing is, I wouldn't say just like functional medicine,
Mhm.
because I'm still practicing in the realm of family nurse practitioner. So what I'm doing is just more of a holistic approach that I've kind of gathered, right? Like, a lot of patients really don't need to be on blood pressure meds. It's more of inflammation causing, right? So if you get to the root problem of maybe their diet, their day-to-day life, their stress, right? Our adrenals, if we're able to really micromanage and like really biohack, right, our health with what we're doing, it brings awareness to us and it makes us realize, oh, maybe something is wrong. Oh, maybe I am tired. Oh, maybe I'm not sleeping, right? Like, we're not taking care of ourselves and we're giving so much to our patients every day. And then we're not able to show up for our business when our cup is empty. And I've been there many times. And so it kind of was a pivotal year for me to really dive into what I really wanted to transition the business into, because I really love that wellness challenges me as a provider. Not that aesthetics is not hard, because we both know it's very challenging and there's a lot of anatomy knowledge. There's a lot that can happen. And I think it really just decreases my liability risk as well as aesthetics and wellness now. So we're not doing as many injectables, right? The more injectables you do, the more risk of VO and complications. And I've kind of also switched the business to more regenerative. So PDGF, PRF, and PRF gel. So doing a lot more like exosomes and things of that nature. So just really all regenerative medicine. But typically when the patient sees me for an appointment, we go through everything. I go through their med list, their surgical history. Have they had hormones before? Have they not? And I use Avexipel or Avexius. That is a competitor of BioT, which is also another hormone provider. And I like the Avexipel method because it really dives into the patient's like overall well-being. We look at thyroid, we're looking at vitamin D. So Avexius is really who kind of taught me how to do my hormones. So when you sign up with them, that's also who I do my peptides through. So when I see
Oh,
the patient virtually, we do a lab workup on everyone. So they pay either 250 for cash pay, full assessment labs, just kind of including everything from CBC, an iron panel, a full thyroid panel, triglycerides. We want a full lipid panel. I like to do an insulin fasting level when they are on weight loss because that insulin level fasting kind of tells us, do they have some insulin resistance? If they have insulin resistance, then we know we need to up the weight loss medication dosing, right? Because we know that that peptide works well, or it's going to work better for that patient because they're going to need a little bit more of it if they have that insulin resistance. So it's going to help their pancreas work better. And patients are like, why do you do labs and other people don't? It's like, I can't give you this medicine without checking your thyroid, right? Because that's a risk of me as a provider for them to get thyroid cancer. And so we really have to be that expert and say, no, you have to get your labs, and holding them accountable that if they want to do this, they're going to have to commit. So that's also the type of clientele that I'm attracting is committed patients, patients that are wanting to really focus on longevity. I hear from my women all the time, oh, I'm not happy with my provider. I'm still tired. They're not looking at the full labs. And I'm really honest with them. Like, if you're working 60, 70 hours a week, your body is going to feel run down. Like
yeah.
it just is what it is. So it's just creating that awareness in them because I've also had my own personal journey of the business, creating health problems within myself of me not putting myself first. And so going through that own personal journey has made it really honestly so much more passionate for me to help my patients because I was also there. So I kind of go through everything with them when they get their labs back in like a week because we don't have in-office labs right now. That's a little bit of our lag time, but we're going through a remodel. And when our remodel is over, we'll have in-office labs. So in about like 3-4 weeks, that will help the turnaround so I can pellet patients or I can send them testosterone in. But a lot of my women, even in their 30s, I'm seeing low progesterone, low vitamin B, low vitamin D. So just nutrient, mineral deficits. Yeah, it's crazy when we really start drawing those labs and really analyzing the blood. So most of my patients I'm telling right now to get their labs done at least every 6 months, if not once a quarter. So we're all cash pay. I'm not insurance. And so I'm kind of weeding that out as well, just to kind of make the flow a little bit easier for the staff because insurance is a little bit difficult.
What states do you hold licenses in? Are you primarily
Yeah,
just doing virtuals in Arizona and then virtuals
Arkansas.
like in Arkansas?
Well, I'm doing them all on Central Time, which is my time zone where I live, through Aesthetic Record is how we're booking them. But I do Arizona, Arkansas for controlled substances like testosterone, so hormone replacement. I can ship it to the client so we can do a virtual. I get labs done and then I can manage them virtually. A lot of patients really like that instead of going in to get a shot once a week. People are busy. They don't want to go in and get a shot. Even if it's their testosterone shot, they would rather be able to draw it up at home. So I like being able to do that for the client. A lot of my patient in Minnesota and Illinois too. So for those 4 states,
So, you take them on, you said you do it's like a one-time fee for them to meet with you initially. How are you following up?
pellet patients, like, so say some of my patients will come see me and um, they will get a pellet, their testosterone will be low. So we'll do a pellet. I'll start my women premenstrual. If their progesterone's low, or my menses women, they'll go on to micronize, a cleaner version of progesterone. And we don't want our patients to have any like synthetic hormones, right? So the more bioidentical, the better, which is why we love like pellets because they're bioidentical to our natural hormone. The study closed last year and it basically said that estrogen only like Prim Pro and Premarin is what causes breast cancer, which we know is like synthetic. And so that's why I try to tell my women if we cannot take things that are synthetic into the body that are more bioidentical, it's better and less cancer causing. So now we know that testosterone is protective for women for cardiovascular disease, for brain health, for our breast health too. And also testosterone helps support the thyroid. Also, just like women, I'm seeing a lot of women that are like having issues getting pregnant. And we're doing like some cycles of progesterone to help with that fertility. And so I didn't even expect to even have some of these patients coming to me. I thought it was just going to be like weight loss. But I think they trust me, like they see me share different case studies. And so some of the patients will be seeing me monthly. And then some people will be, if they want to refill for weight loss, NAD or, Cimarelin, the human growth hormone peptide, or if they want to be on NAD, then those are monthly refill visits. And so then I do a $99 visit for refill time because I meet with them and I make sure they're tolerating everything fine. Okay, do we need to follow up on any more labs? And then that way our visits every month will get a little bit easier. Sometimes it's a lot in the first 3 months, but I'm not putting my patients on a ton of supplements unless they're wanting it. But I do partner with Cellcore for like some liver kits, some parasite cleansing, and I will recommend those more when we get our bigger space. So we'll have those for the patients to do some more supplementation orally.
Nice.
A lot of it's just injectables and hormones. So a lot of weight loss, a lot of like testosterone, estrogen, progesterone, and kind of getting these patients in awareness and on like the right track. But I'm having a lot of like women, a lot of husbands coming in, and a lot of like younger entrepreneurs wanting to optimize.
Nice. So it sounds like what you were telling me is you had a really solid foundation in traditional healthcare. But
Yes,
obviously, some of this that you're learning is outside that realm of what we would
it
call like the
is.
traditional healthcare space. So if someone is listening and they're like, oh my gosh, I'm actually more passionate about that wellness side, like Shelby found that
Right.
side, she's really passionate about it. How do you feel is a safe way for people to kind of learn
Dive
more
in.
about this? Because I think, like you're saying, there is money in wellness.
Hmm.
And I think that's the scary part, right? There are people out there that don't know what they're doing, or they're doing things with the intention of like, hey, do this pellet because it's X price. And maybe they're
Right.
not a great candidate for something like
Right.
this.
I would say always having a nice healthcare lawyer on your side to know your rules and regulation for each state. So my healthcare lawyer has been with me for since I started, and she gives me guidance. So if I want to bring on something new, we make sure, okay, it's covered under malpractice. We make sure legally this is okay. I do some business coaching too for people, Sometimes I'll let people buy my policies that I made, things like that. There's tons of conferences. Dr. Jason Pinchek, I believe, is his name on Instagram. And he's a chiropractor that went to nurse practitioner school, like RN to nurse practitioner. And he's been biohacking now for 6 years with peptides, but he's been an MP for about 10 years. I would definitely say like following someone that's already doing it, going to shadow them, going to get that knowledge, just like we would if we were in aesthetics. I did the same
Okay.
thing when I kind of started learning aesthetics. You're not going to learn it by reading a book. You're going to learn it through like actual patient encounters. It is challenging, but I like that little challenge of, I think that old ICU nurse in me. I like looking at all the labs and kind of figuring out the problem.
Hmm.
But most of my patients will meet with me monthly for the first like 3 months. And then it depends if they keep doing the pellet or, if they keep doing the peptides, then they sometimes they'll be on weight loss with me for 6 months. And as they're losing the weight, I'm obviously a trained provider. I can also provide them with the injectables that they need for the weight loss too. And I think that it's kind of nice that your patients will trust you if you decided to add in weight loss. I already trust her with my face. I want to go see her for weight loss. So adding in those appointments, I think it does carry a liability right now, right? Because
Hmm.
there's the big lawsuit with Big Pharma and the compounding pharmacies right now, the compounding pharmacy that I'm with, they're functioning under the FDA umbrella that it's safe to do currently. So that's also one reason I love Avexi. I have my pellets with them, my hormones, and then I also have my weight loss peptides. They're FDA approved manufacturers. So I know that what my patients are getting is FDA approved. It's a clean product. I know it's monitored and I'm able to see the results in the patients, right? If a patient isn't having results, that you should wonder why. Why are they not losing weight on this? So you want to wonder, like, is it from the pharmacy? And I have a lot of patients in Arkansas specifically that I've been seeing that providers are not ordering labs. So they're literally just starting patients on weight loss med without any labs. The patient comes to me after all their weight loss and they're like, I have no hair left. And so, if they would have optimized their vitamin D, their iron, their ferritin, their thyroid while they lost their weight, maybe they wouldn't be leaving that provider. They would be staying. So I'm also seeing a little bit of that, maybe going from a less experienced provider to a more experienced provider in the wellness rim. Like patients are really wanting someone that's knowledgeable.
Yeah, well, I think that the concern being when I was doing my nurse practitioner degree and it was in primary care, but you would see
Yeah.
it a lot where they would go to somebody, not have labs done, they're
Yeah.
increasing their dose fast, they have no appetite, they
They're
have
just
lost a bunch
wasting
of weight.
away.
Right, they've
Yeah.
lost a bunch of weight, but it's not sustainable. But
No.
then also they haven't made any lifestyle changes, and then they
You're
possibly
like,
come off, and then they're worse off.
right.
My concern is when you add wellness to your practice, how mindful are you being? When you are doing weight loss, are you connecting them with a nutritionist?
I
Are they
kind of
getting some type of workout regimen? Or how are you supporting them in that way?
Right. I give them tips and tricks in our consult on like how much protein to meet per day. Definitely I recommend strength training for anyone on GLP-1 therapy. We know that we can muscle waste with it, right? It can eat our fat and muscle away. We know that with aesthetic patients specifically, we're seeing a lot of the orbital hollowing, so temple and under eye, mid face. And if they're on that, we know it slows their collagen production down on the tissue. So from last injection, it can be up to 6 months. So these patients are really having to do a lot of like neck treatments, décolleté treatments, back of arm, radius, hyperdilute, sculpture in these areas because they are losing that visceral fat, that brown fat, that hard to lose fat. And I think it's good as a provider to say, like, yeah, we can microdose, but also knowing when enough is enough,
Yeah,
and really keeping those patients accountable. Okay, are you drinking your water? If you're not exercising, you're not going to be losing your weight. Like, if you're not getting your protein in. And another thing for my Arkansas clients is we have an in-body scan. So we're
nice.
actually able to have those patients come in our clinic, if they're not a virtual and they want to come into the clinic in our location, we do offer a free assessment of our in-body scan. So it'll tell you your muscle mass and body fat percentage. And that's a nice tracker. And, it fluctuates obviously depending on the time of day and what the patients ate. But first thing in the morning is the best and before a workout. And I'm kind of counseling people. Some of my patients go to a trainer that I refer to in Arizona, and some just do their own workouts, right? But I do try
Mhm.
to hold my patients accountable and I try to tell them not to do a lot of cardio and a lot of Pilates because then they're going to lose their booty and they're going to be mad and they're going to be like, well, I took this drug and I ate my butt, right? My butt fat. And it's like, you have to get your protein. I tell people, I mean, if you can at least do 100 grams to 120 grams and the same for water a day minimum, right? While you're on it and to strength train, not doing a ton of cardio, even if that's like their stress reliever, they're just going to be burning too much fat. So then they need to be on a really low dose if they're not going to want to, if they want to do a lot of cardio and they're already kind of smaller. So I'll still prescribe a microdose to someone with a normal BMI, right? Like we
Yeah.
know that we're not treating just obesity with this anymore. It's inflammation, it's brain fog, it's people looking for more energy, more focus. If they have bad ADD, you can put them on a low dose trizepatide and it really helps them come off maybe like their Adderall dosage and things of that nature. So
Yeah.
it's really cool.
The peptide space and the GLP-1s, all of that stuff is so exciting to me. Again, I'm not
Yeah.
gonna pretend like I know anything related to it, but I think that the future of it is really cool. My question for you and how you're kind
Yeah.
of managing this is with the semaglutide and the tirzepatide. they're able to be compounded right now because they're on the drug shortage list. And
Mhm.
are now starting to see some of the compounding pharmacies pull back and they're
Yeah.
saying, "Hey, it's only available till X time." Like, what is that added stressor? And like, I guess, what
Yeah.
is your game plan for
That
these people that
has
are microdosing, you know?
stressful. This all started last year. So I've been doing weight loss for a couple of years.
Mhm.
And so I'm still injecting and I'm still keeping my skill set up, with my clients, but I'm just not doing as much injecting. I have that kind of offloaded to my nurse. And then, like I said, she helps me with my virtuals. But really kind of what we're seeing, I feel like is, patients they're coming in and they have one bucket, right, of money to spend. And you're really seeing them kind of dive into the wellness. So I do
Mhm.
think it's smart that aesthetics practices are adding wellness in because it keeps the money into the bucket of the practice, right?
Mhm.
Because at the end of the day, it's not all just about injectables. Because I mean, I don't know how far in your aesthetic career that you're in, but at some point you kind of just get tired of doing lips and full face, right? And when you want to add in that like other challenging part for me, it was just adding in that wellness, right? And so I would say long term, this has been an issue the past year with the lawsuit. So this is something that I think hopefully we'll have an answer by the end of this year and this will be over. But
Yeah.
right now, I don't prescribe any semaglutide. I think it's a little bit of a bigger risk
Mhm.
than the trizepatide, and
Yeah.
trizepatide right now we're okay with the Vexi pill currently. They have marked that as not as the same formula. So that's the
Gotcha.
thing is if it's the same exact formula, these pharmacies had to add in like a nausea medicine or like, a B12 or
B12, yeah.
B6 and their big pharma's like, "No, you can't do that." Right now, they're still in limbo.
Right.
Some practices are sending stuff in directly to Lilly, but then you're seeing the practices not make any money on the compounding. So if I send NAD and Cimarelin and trizepatide for a patient, I'm making money on all three of those. Typically with wellness, it's about a 30 to 40% margin, sometimes 50, whereas aesthetics is 20 to 30. So you're getting a little
Mhm.
bit of a less work, less labor, and then you're also doing higher return value sometimes,
Right.
just depending on what the patient buys. So it's a little bit different than aesthetics. And I do think it adds on a little bit more stress given the current situation with FDA and the small pharmacies, but they're really going to bat for this and for us and small businesses. So I'm really hoping that it just doesn't pass and that we continue on the path that we are. And you can still make money in hormones and things of that nature and other peptides, but weight loss is a big producer in most people's practices. And I think a lot of people have either let it go or continued on. Right now, I'm continuing on. And the risk would be they would come in and probably just tell us to stop right now, but we're not doing anything out of the norm. We're getting it through a Vexi pill. It's an FDA approved pharmacy currently, and my malpractice insurance still covers it currently, the
Gotcha.
compounded. So those are
Yeah.
some things that they can think about too when they're looking to add that in. We always take risks.
100%. I think that you know, and I think majority of people that are in this space know that we operate in a lot of the gray.
We
And I
do.
think you do have to be okay with that in a sense, right? Like I think that there's checks and balances and different things that can keep us safe, but we
Hmm.
do operate off label in a lot of ways. And to be in this space, you have to be comfortable with that.
Hmm.
My question for you though is, say that this bill does pass, like is your plan going to be to send directly to Eli Lilly? Because I mean their patent
Yeah.
technically is long standing. Or are you gonna try to switch to like a liraglutide or, one of those other.
Gonna go through the same thing in 2026 when retatrutide comes out, and that's the
Right.
new big one. It's supposed to work on 3 receptors. It's finishing the
Versus the
last.
2, yeah.
Yeah, and I would say Sema is like low totem pole. It's not the best drug on the market. Trizepatide is. It's why everyone's on
Right.
it. It passes the blood-brain barrier. Retatrutide, maybe once all this is over, yes, I'll use Eli Lilly Direct and we just charge a refill fee. So it'll be a little
Yeah.
bit different profits, margins. But like I said, we're still doing well with our NAD, our hormones. Our hormones is really growing. And you have to think those are monthly refills. So
Mhm.
these are monthly meds for patients.
Yeah.
Even The Simorelin I like, or Simorelin, people say it both ways. The Simorelin, it's human growth hormone peptide. So you really want to make sure patients don't have any active cancer with this, with NAD or Simorelin. So that's my biggest thing in the workup. You don't necessarily have to have labs for those, because those are going to be more working kind of like, we don't want any cell division that you already have
Right.
active cancer. So I kind of go through that with the client, like when was their last pap smear, colonoscopy. We kind of put all that into the chart. So, like, for example, I had a patient a couple of weeks ago and she hadn't done her annual. So it's like, okay, well, we got to get these done before we can proceed with this. So that's some of it. It's not fast and furious. So we have to wait sometimes in
Yeah.
that wellness realm where aesthetics is like, you already see the result. Wellness is a little bit different, like being patient with patients that they're not feeling their best yet, kind of hand holding a little bit, but they really love the injectable stuff, because
Yeah.
people forget pills. So I feel like they love a little human growth hormone with their trizepatide. So that's what's nice too. If you can maximize people, they don't need the weight loss med long term, or
Yeah.
you just need less. So that's really my goal of with my patients, is really just optimizing them to their max. But we don't have to do it all fast and furious. And that's what Dr. Jason did too. He's like, let's not start you on 10 meds today. Let's just see you back in a month. Let's follow up on
Yeah.
these couple that we did. So you really get to develop it as you want it to be, right? And
Yeah.
so, of course, I would like to do some more shadowing to some other concierge medicine doctors. It's kind of what I'm transitioning the wellness business to,
Yeah.
specifically in Arkansas. You have 24/7 access to me. We are launching our memberships in September for our
Hmm.
wellness. And so we have some IV hydration too. I know you mentioned you have that in your practice, but
Yeah.
you have to be careful with that because of the Texas law that came
Yeah.
out, right? Someone passed away,
100%.
and we know safety is important, but when we're doing an
Mhm.
IV, it has to be, it's very strict now. So yeah, we've added the IVs back into, like, if they're getting facial filler and they want an IV, we have that now. A lot of people are loving the NAD. That just
Mhm.
helps decrease your risk of Parkinson's. It's anti-aging, it's an antioxidant. MTHFR, a lot of patients have that. It's a histamine, kind of how we like synthesize it and process it. It's a buildup of histamine in the liver. And
Mhm.
so a lot of patients need liver detoxing, like I have MTHFR, and
Okay.
it makes sense why I've experienced the symptoms I have most of my 34 years of life. So I just found out this year. And people with MTHFR need NAD, right? It helps them get rid of that histamine response that's building up. So it's just so much in the wellness realm, and it's overwhelming for people, but I would definitely say add it in stages. So, like, if your
Yeah.
goal is to really launch wellness, like, launch it in increments, because obviously developing the policy, implementing it with staff is hard. But what I love about a Vexi pill is I see the patient virtually. I tell my nurse what to order, what labs to order, and she puts the orders in. I verify the order. The order goes through to them. The pharmacist verifies it, ships it to the patient, and then we're done. And I still use, even for like financing some of my stuff on Cherry. So
Interesting.
if the patient is checking out, I will just do them, like, if they're doing their lip filler and they want to refill their meds, we'll put it all on one.
Yeah. Interesting. I really appreciate this conversation. I don't think I want to spearhead this. I love my role as an injector. My goal is to master that area, and I feel like
You want
what
someone else to
some
kind of master the
right,
wellness. Yeah.
right. It sounds like you've really established like a really good balance between the 2 and kind of how they kind of mesh really well together, and you can tell you're
Yeah.
super passionate and you have that background experience, right? Like there's so much that goes into that, and having that role as a provider and being able to take that on, I think it sounds like you've really set it up well and are the perfect person to do that.
Thank
But
you.
the biggest concern kind of I have is the people that wanna do it all, right? It's like trying to master everything, and if you spread yourself too thin, you're just not gonna give the best results, like, to anything, you
Right.
know?
And I kind of felt like, not that I had like capped out in my injecting career, but I'm like, I
Yeah.
feel like I've already done all this, like,
Yeah.
that's just what I felt like. And I was also like struggling with high overhead, staff. Like, it was a
Mhm.
lot of stress and pressure. And that's what made me want to transition. And so it's like, I love that I can still inject, but I don't have to inject all day for revenue. And that's what I enjoy. I can sit at home virtual, working, running errands, fit that into my day. So it's a little bit more of a better schedule than just injecting all day.
Yeah. I don't think that this is said enough, but I would say majority of the injectors that are really happy in their role, they're not injecting full time,
Yeah,
5 to 7 days a week. At one
it's
point,
a
I was
lot.
5, sometimes 6 days a week, and
Uh,
that it no longer gets to be fun and passion and the best parts of the job. It
yeah.
becomes
It
monotonous.
becomes the business, like, the business can take over sometimes and be the driving force, and it took over for a long time for me, and I just in my mid-30s, I just really decided, like, I've done a lot with my nurse practitioner, with my background, I'm very blessed and very thankful, but, like, where do I wanna go in the future? And where I'm challenging myself and put myself in that pivotal role, it was very hard, but, it's been a nice transition. I'm hoping that there's gonna be more, like, aesthetic plus wellness conferences together in the future.
Yeah,
I think we'll start seeing more of that. Right now, they're kinda separate, and I wouldn't say, like, I just capped out injecting and I was like, "Oh, I'm the best injector ever." No, that's not what I thought. I just felt like, "Okay, this isn't, like, as motivating for me anymore."
yeah,
And then when I fell into the wellness, it's like, okay, it just made sense to promote my nurse to full-time injectable and for me to kind of have that like stay at home, but also be in the office kind of like hybrid approach. And I really love that. And I feel very blessed that I don't have that big staff and big overhead anymore because I think that wasn't in alignment with what I truly wanted. So you always have to
right.
kind of look at that for your business.
So my question for you actually
Yes.
running on that was in talking about some of the mistakes that you have made and kind of
Mhm.
helping prevent others kind of make those similar mistakes. Do you feel like when you had started your original practice and then when you grew, did you model it after other practices you thought looked successful and
Yeah.
maybe wasn't like you said you ended up looking back and you're like I don't know if
Oh,
I want this.
yeah.
Like is it one of those things where you felt like maybe you were doing things because you saw it being modeled in other
Well,
spaces.
in Scottsdale, like, one of the mecca of aesthetics, right? Like, Scottsdale is high competition. There's 12,000 med spas in the valley in general. So you are competing feast or famine. And then you're looking at about 5 months of the year decreased sales because of the heat. So that's why
Gotcha.
I was pushed to more create a training program, shadowing, I'm trying to meet my overhead. I'm trying to keep up with the competition. And, I made a great name for myself there and have some nice contacts. And
Yeah.
it was great. But I definitely feel like we all make our mistakes in our business. And that's where I caught myself. I had a big team, I had a big overhead. I ended up letting the team go and felt a lot better because I didn't feel like I wanted to be a manager. Yes, we have to be a leader and we have to lead and we have to step up for our team, of course. But you also want your team to be supportive of you. Where's my team support in promoting on Instagram or, is maybe promoting the wellness stuff. And so it's like, I feel like I'm in a good space right now with my team. It's all we need. It makes me happy. And it's like sometimes less is more.
Right.
That's just kind of where I'm at. And so where everyone's different, but yes, I made a lot of mistakes along the way. I've overspent on a lot of things, trying to keep up in Scottsdale. And it's like now that I'm back home, it's like I don't have to inject with that overhead. I get to really practice, ethical injecting and I get to have the products in my office that I want. And I don't have to worry about big pharma coming in trying to push more to me. And so that's what I really love too. I kind of weeded out a lot of the high stress, big pharma stuff and the circles and the tiers. And I kind of cut that. And I really started focusing on like, what do I want in my practice? What do I believe in?
Yeah.
And I think it's good when you do that because you really feel in alignment moving forward. And it's a hard step to make.
Were you learning how to inject when you opened the practice as well?
Only about 3 months I worked for derm, like, right
Okay.
before I transitioned out of cardiology and took a derm position in Arkansas, and as soon as I was there and got, like, Galderma and I think I was, like, MERS and Allergan trained from the dermatologist, and then it was like 3 months injecting, barely, but I
Mhm.
really felt that passion and I had that eye. So I was always been like a fast learner. So
Mhm.
I took that like power of me losing my job and started like learning online and reading books. And that's also kind of what I've done with the wellness. I've read some like holistic books. One book is it's a good energy book and it really talks about this ENT doctor too that left the big healthcare and went and opened her own practice, and she really started doing
Yeah.
studies, and she realized a lot of the ENT disorders were inflammatory disorders. And
Mhm.
what causes that? Like, what's the root cause? She was just so curious. And there's also a hormone book called Hormone Havoc by Dr. Terry. She's also the leader of Avexipil. So she puts it in
Mm.
more layman terms for patients to understand. So that's also another really good book. I've always been like a researcher, so like I kind of
Yeah.
self-taught myself aesthetics and I kind of did the same thing now thinking back for wellness. But again, just whoever you're inspired by, like I was inspired by Dr. Jason. So I was like, I'm going to see him. Like I want to hang out with him for the day and learn from him. And that's what you guys should do too, right? Like come shadow, come learn, because you're not going to know until you get your feet wet and see it a little bit.
Right. Very cool. So,
Yeah.
any last pearls, pieces of advice, anything you'd like to leave those listening today?
Yeah, I mean, just take a risk. Sometimes you can't live in that state of fear forever. My mentor tells me all the time, we have two emotions, love and fear, and you have to remember which scale we're in. And I've really been living out of fear for a long time. And it's like, I really feel like I'm in this like loving light era now. And I think it's because I started listening to myself and what I really wanted. And I really hope everyone else does that and takes a leap, of faith for themselves and for their business and what they feel like is right.
Okay, well,
Yeah.
tell everyone where they can find you if they have any questions on social
Yeah.
media.
Yeah. Snatched by Sloan. And then our office phone number, if anyone listening wants wellness, is 602-702-53. And our new website will be out soon. So you can follow us on Instagram to see that. And it's a whole new wellness remodel. And I'm really excited. If anyone has any questions, they can always send me a DM. I do have all my highlights updated for like education and trainings. I always try to post for other injectors too. So yeah. Thank
Well,
you,
thank you so much,
Kiki.
Shelby. I really appreciate
Yeah,
your time.
of course. See you guys.
And that was a wrap on this episode of season 6. So, again, thank you so much to Shelby for taking the time to record today. So, only one episode left of season 6. Excited for you guys to listen to that. Excited to hear your feedback on season 6. And again, you know where to find us. We are at aesthetic.chatwithkiki on Instagram. My Instagram is at aestheticnurse.kiki. Our website is aestheticnursekiki.com. So reach out on any of those platforms if you have any questions, recommendations, comments about the pod or injecting or life. Excited to interact with you all and hear what you guys have to say. And lastly, I think it's very interesting that now we've had two guests on this season that have talked about being authentic, having authenticity. I think it's really seems to be a theme of the season, as well as, leadership and possibly the do's and don'ts and things to consider when you are opening a practice. So, yeah, so far our guests have had a lot of knowledge for you guys, and it's really exciting for me to learn as well as for you guys. So, keep listening, head over to the last episode, and I'll see you guys soon. Okay, bye.